thank you for having us today. This is a really exciting opportunity. My name is Chris Malaro. I'm the co-founder and CEO of NeuroFlow. And we're excited to talk to you today about how technology, not just our technology, but technology in general, is being used to increase patient engagement and throughout the mental health therapy process. So quickly, I'd just like to introduce myself and my co-founder and chief operating officer, Adam Pardis. I come from a military background, so I was pleased and excited to see about 10 of my current West Point cadets here at the conference. I'm happy they're here and getting this experience. I served for 6 years deployed to Iraq, was a platoon leader, transitioned out and went to business school. And at Wharton is where I met Adam, who is getting his PhD in bioengineering from Penn. And so Adam and I personally had a friend that suffered from PTSD and lost his battle and committed suicide. And I viewed that as a failure of my leadership, my friendship to him, and this is a personal passion mission that I'm on. So 2 years, Adam and I embarked on a research journey with Penn and advisors there and created what is NeuroFlow. So without further ado, we'll get into the presentation.
All right, so like any good presentation, of course, starting with our disclosures. So Chris and I are obviously both compensated by the company. Brian Daly, who will be speaking today, is a paying client of ours, as well as compensated by the company as an advisor. There's a number of technologies, organizations that we'll talk about today. Those aren't endorsements. We're not speaking on behalf of them. And any mention of that is not with their endorsement. So with that, we'll get started. There was a recent report came out about 2 weeks ago from Accenture. Really, really thorough report. I'd encourage people to check it out if you're interested in technology and mental health. And really interesting to see how much growth is still happening in this space. So if I told you compared to 5, 10, 20 years ago that technology is bigger part of healthcare than it was, you'd believe me. If I told you 2018 versus 2016, we're still doubling some of the adoption of this, I think it's really quite astounding. The ones I've highlighted specifically are mobile, so people using more and more apps, more and more the browser on their phone, wearable technology, which again, I think some people would think it's probably on its way out, but actually continues to be a big part of people's lives. And the last piece there is remote monitoring, which we'll talk a good bit about, and I think is really relevant for mental health. And even though it's all the way to the right there, I think you show this presentation 2 or 4 years from now, it's going to keep creeping its way to the left the same way as mobile has. Not only are people using more of this, but they're willing to share it. So consumers, an astounding majority, right? 90% are willing to share that with their doctor, and that hasn't changed over time. That's over the last couple of years, remained really high. Willing to share with family and friends, not shown here, social media, insurance plans. People are more and more willing to share this data because they see the value that it provides. So we'll talk some about wearables, and I just wanted to address it head on at the beginning. Not all wearables are created equal, right? So a lot of people think of wearables, they think of Fitbit, Apple Watch. Those devices serve a purpose. There's really great data that you can get from them, but it's not going to be exhaustive, right? So there are also wearables that measure heart rate variability, which we'll talk a little bit more about later, as well as even EEG, now in fairly cost-friendly ways, totally wireless, easy to use. And obviously the data you get from an EEG headset is very different than when you get from a Fitbit. So when you think about wearables, I think it's time to start expanding what that really means to us. So not only are people using it, not only are they sharing it, but they also see the value in it. So again, from that Accenture report, people report that they feel like they understand their healthcare better, there's better quality of care, and that bottom right one I think is a really important one, that patient-physician communication. They feel like there's a more streamlined communication there. So I'm going to pass it over to Chris now.
Thanks, Adam. And so this is all really exciting, but what's the so what, and how can we use this information to increase patient engagement and improve mental health care? And so I'll start with a little story. I told you my background, I'm in the military. I have a personal connection to mental health issues. But there's a number that stands out in my mind, and that's 20. And we know that 20 veterans a day on average commit suicide. This was the reason I got involved in this. Access to care is a problem, patient engagement, stigma, feeling like you're not making progress and so you drop out, all are all huge issues. But they're certainly not limited to just those in uniform. These are human issues. 8 million Americans a year struggle with PTSD, many more with anxiety, depression. And a startling statistic is that of those that drop out of treatment, 70% end their treatment within their first 2 or 3 sessions. And it's just like anything else, if you're not going to stick with it and comply with it and be motivated to continue along that journey, you're not going to reap the benefits from it. In fact, a lot of research backs this up. So there's plenty of research that shows that for a lot of therapy protocols, 11 to 13 sessions really is the sweet spot for those protocols to take hold and to have a lasting effect with patients. I'm sure that this room, more than anyone, is very familiar with all of these different type of therapy protocols. And one common denominator with a lot of these are doing homework. So the outside the clinic engagement. You assign journal entries, or you assign journaling, maybe you assign mindfulness exercises, do 5 minutes of mindfulness a day. Maybe for exposure therapy, you assign some sort of exposures or behavioral experiments to do. Goal setting and journaling worksheets are obviously very prevalent in asking patients to do this stuff, not just in the clinical setting, but in that huge amount of white space from the session that they're seeing you to the 2 weeks later when they're seeing you. Yet, we're all busy people. Patients are busy as well. They have families, they have jobs, life happens. They might not comply for a variety of reasons. But homework compliance, research suggests, is entirely important for better outcomes. Obviously, you're not assigning them to do those journal entries for your own well-being. You're doing it because it's for their improvement, for their better outcomes. Mindfulness exercises, mindfulness-based stress reduction is for better outcomes for them. So the question is, how can we increase this compliance and motivate them to be adherent to this protocol? This was a startling statistic that we wanted to point out with how technology, specifically applications, are improving motivation, confidence, self-reports, sticking with treatment. And so this is the impetus behind the technology that we created and a lot of the research and other applications, wearables that are moving along and supporting the industry today. So speaking about ways to increase compliance, increase adherence, there's a behavioral economics component called nudging. So you want to nudge the patient. You don't want to, no one likes being told what to do or demanded what to do. I didn't like it when my parents did it to me, and I certainly don't like it when my provider does it to me. I deal with it when my wife tells me to do it, but no one likes being told what to do. But if you could nudge them and politely suggest and help them, really help them help themselves comply with that treatment, outcomes are vastly improved. So certain ways to nudge patients, but people in general, are providing incentives. So there's, those are obviously monetary incentives, but there's other ways to incentivize patients, social pressure, specifically with monetization incentives. There's the compliance rate doubles if you incorporate what's called loss aversion, as opposed to getting $1 is great, but losing $1 that was given to me is even worse. So if I can say, here's $1 for you, but if you stop going to the gym every week, I'm going to take that $1 from you every week. I'm more apt doubly to comply with that. Caring letters, just the notion of having a touch point with someone, letting them know that you're there, that they have support, that things are going to be okay, is provides a huge improvement for suicide rates. So there was a fantastic Stanford study that really demonstrated this, where they sent caring letters to patients that were at high suicide risk 0 to 6 months after being discharged from the hospital. That's when they're at highest risk for having suicide ideations and following through with that. Those that got caring letters, the suicide rate dropped by half just in those first 6 months. Push notifications. So getting emails, just reminding you that, remember you have a PHQ-9 to fill out on your app, or remember to do that mindfulness exercise, that this is a practice skill that you might not be great at it right away, but like with anything else, if you practice it, you'll get better at it. It provides that positive affirmation. And that leads to data visualization. So the analogy I like to use is, for my New Year's goal, I wanted to lose 5 pounds, get my waistline back to when I was in my early 20s. So I wanted to go to the gym to try to accomplish that. I go to the gym for a week. I look in the mirror, and there's not a difference. I still have those love handles coming in, and it discourages me. That week I worked really hard at the gym, but if I step on a scale and I can measure a difference of a half a pound, I can measure that difference. I could see that tangibly, that my progress is working. Even if it's small, it's iterative. That motivates me to get back in the gym and continue doing that. And so data visualization then applied to mental health can work in the same manner and using wearables. So we'll talk about it in a second, and Adam will talk about our research at Penn, but being able to actually quantify emotional states. How well was that mindfulness session that you did over a longitudinal time period? From session 1 to session 3 to session 10, are your stress levels decreasing objectively, paired with self-report measures as well? And so that's really what the NeuroFlow platform is about. We encompass all of that into one easy-to-use, HIPAA-compliant platform. And so patient engagement, you could assign homework assignments, then they get email updates. You could put due dates on there. They'll get app notifications to let them, remind them. They could earn incentive rewards. So we have positive impact points, they're called. So every time they go in and do a mindfulness session or a journaling exercise, they get rewarded points that, when accumulated, can be redeemed for gift cards to like Whole Foods and stuff like that. All things that would benefit the holistic well-being of the patient. And then we pair with wearables too. So just as some examples, Adam talked about heart rate versus heart rate variability. So the Polar chest strap we pair with, this gives us heart rate variability. We can get coherence measurements and relaxation measurements from that. We have, this is the Muse headset that we've partnered with the company. So this is a prefrontal cortex EEG headset with 4 electrodes. It's as simple as just turning it on, putting it on, and it measures your alpha, beta, theta, delta, gamma waves. And we've developed algorithms that now can quantify relaxation and stress on an objective scale. So it's incorporated in this one platform where the provider has a dashboard that you could track progress remotely, and the patient has a platform they could log in the comfort of their own home to take ownership of their care, increase their engagement in and out of the clinic.
So I'm going to talk a little bit about the wearables, specifically the science and research behind what we do. 'Cause that's, I think, what's most innovative. A lot of the other components are great for making the provider's workflow a lot more seamless. Instead of handing out paper and pen questionnaires or worksheets, being able to do that, digitally, remotely, makes their lives a lot easier. But certainly the physiology is something that we're really excited about. So EEG has been around for a long time. Almost 100 years at this point. The challenge is that what it looked like, decades ago was this sort of really massive montage, lots of gels, really expensive equipment, like very burdensome to use. Great in a neurology unit, not so great in a clinical psychologist's office, right? And in terms of the interpretation, even if you had one of those, you had to probably be a neurologist, someone who understood how to look at the raw voltages coming out and find patterns and look at stroke detection, epilepsy. So it's a very specialized modality, but very sensitive as well. Good news is that, like Chris showed, wearables are now reading some of this data. So I wouldn't recommend using a Muse for seizure detection, but for things like measuring relaxation, looking at the prefrontal cortex makes a lot of sense. There have been studies that show the efficacy of these devices compared to more standard systems. So imagine there's a mix in the audience of how familiar people are with EEG. Basically, each of these waves represents different things that are going on in someone's mind, whether they're focused attention or relaxation or drowsiness, and it takes a lot of math sort of behind the scenes to extract this information from the raw signal. But what we can do is take into account information from multiple of these waves to really get an idea of what's going on in someone's mind, and we'll talk a little bit more about that. So that's one piece of it, is what happens on the brain side. Interestingly, you can learn a lot about someone's physiology through their heart activity, even as it relates to mental health. So the balance between their sympathetic system, parasympathetic system, which way that swings at any point in time. So you do that by looking at heart rate variability. The difference between heart rate variability, if you were looking at heart rate, you would just want to know the number of peaks that happened in a certain period of time. But what actually is very interesting, if you look at the little differences in the amount of time between those peaks, you get patterns like you'll see there in the bottom right, where you actually get that nice, really sinusoidal, consistent pattern when someone's in a really relaxed state. Their breathing rate is in sync with their heart rate. It happens a lot when someone's doing a guided breathing exercise, as opposed to when it's more erratic. But you need certain kinds of devices to be able to be that sensitive, and that can give you insight into whether fight or flight is dominating or rest and digest. So Chris mentioned that we did a study at Penn where we looked at a lot of different modalities. So not only EEG, and in that case we actually used a fuller montage, but also pupil dilations, skin conductance, skin temperature, a number of different points. And what we found was a lot of these modalities on their own are either specific or sensitive, but it's challenging to get all of that in one go. What you can do is use machine learning to take information from each of those pieces and get high accuracy, high sensitivity, and high specificity, because of the amount, the wealth, and the variety of data that you're getting. And that's exactly what we found, and really what fuels our algorithms when you look at like a relaxation index. It's taking into account a lot of these different data points and how they interact with each other. So I'd say one of the elephants, or in this case, hippos in the room, is HIPAA and the FDA, right? So when you think about technology, you think about mental health. All right, well, how is this regulated? What happens to data privacy? So when it comes to the FDA, I'd say at the end of Q4 last year, they released most comprehensive guidance that they have so far as it relates to mobile medical applications. And it is consistent with what we experienced as we went through what's called the 513G process with them, where they review the claims that you're making and judge whether or not it's safe, risky, and if you can sell to providers. And it really depends on the claims that you're making. So as Neuroflow, we don't claim to diagnose any illnesses. We don't claim to be the treatment. This is a modality to augment what a provider is doing. So the FDA in those sorts of cases says, yeah, you're a measurement tool. You're taken into context just like any other measurement tool that a provider would use, and it's we don't see a severe risk, so you're allowed to sell to providers. You go all the way down to something like Pear Therapeutics. Pear Therapeutics released the first digital therapeutic that's FDA approved, and in that case, they are making a claim that this is a treatment. This will lead to better outcomes. If you make those claims, you have to have the clinical studies to back it up. A company like Pear does that, and they do it specifically for medication-assisted addiction recovery. And when it comes to HIPAA, there's a lot of apps out there, software platforms that are used for general wellness, mental health, that don't care about HIPAA because they're really direct to consumer. When you start to create this channel, or this bridge between the providers and the clients, it's a really useful bridge, right? You want to have insight into what people are doing, but it does now get into this realm of patient security, because now you're talking about patient-generated data. So any vendors, if you're looking at using technology in your practice, should have what are called business associates agreements. Basically covers, this is what we do with the data, this is who has access to it, these are the safeguards, and then you're agreeing to those terms. And there should be some mention of that they do data encryption, both at rest and in transit. And all of this it's great to have the technical piece, that data encryption, but that on its own is not enough to be HIPAA compliant. There's a lot of physical safeguards, administrative safeguards you have to have in place. so that at a company like Neuroflow, not everyone is able to go into the database and see patient-generated data, right? So even though it's encrypted, doesn't mean everyone has access to it. So it's something you want to think about when you're talking to any vendors that you might want to work with.
Thank you, Adam. To Adam's point, there's a spectrum here. So the FDA assesses us as a clinical decision support tool, something to support you, the provider, to be a resource to you in your treatment with those, with your patients. And personally, for Neuroflow, I view ourselves and assess ourselves not just as the tool being the resource, but the team as well. So the good news and the really exciting piece of all of this is this isn't just theory anymore. This isn't just research anymore. But we're being used by clinicians around the country with real patients, and it's making a difference in their treatment. Dr. Brian Daly, we were introduced to originally because he was interested in using us in his clinic. He signed up to being a paying client. He's also a professor of psychology at Drexel University. And so I invite Brian up to talk to us about how your patients have responded to technology like this.
Thanks, Chris. So one of the first things you do when you work with a group that's younger than you is you send them a picture that's about 10 years, 10 years younger before you've had kids and gray hair, and then you seem to fit in the group a lot better. This is nice that this is being recorded, so this gets disseminated everywhere, and this is what people think I actually look like. So as Chris mentioned, I'm a professor of psychology at Drexel, and I write scientific papers, I get grants, so obviously data is very important to me. And that's one of the reasons of three that I wanted to be a subscriber to Neuroflow, because I believe in the importance of data and looking at it to see change in the moment and change over time as well. I'm also the director of clinical training at Drexel in their clinical psychology program. And I think what most of us realize is the clinicians being currently trained really want to use technology in augmenting their clinical practice as well. And I think as old people like myself with gray hair, we've not done as great a job in helping them make that leap, even though they know that it works and they want to incorporate it in their practice. And the third thing I do is actually private practice. So I'm a co-owner of a private practice, and I spend about 10 hours a week working with kids. I'm a child psychologist. I'm not effective with my own children at home, but in private practice, I do a decent enough job. But Neuroflow attracted me again because of really the pain points that I see in private practice, which is we have these evidence-based treatments that work, but they're dependent on a lot of factors, a lot of variables that are well known at this point, right? Which is, can we get our kids, or sometimes their parents, more importantly, to comply with the treatment? Can we get them to do the homework? Can we get them engaged in the treatment, right? Can we keep them motivated in the treatment? And having young kids that are really into their iPad, I know how much kids are visual learners, and I think sometimes we're stuck a little bit in still the very let's do a piece of paper together model, right? Like, let's go through this worksheet. And I think there's utility in that, but I think it misses a lot of what these kids are growing up with and what they want in terms of their multimodality learning. So Neuroflow is important to me because I work with a lot of kids with anxiety, anger management issues, both boys and girls, and when I do the exposures in practice, or when I do some of the guided imagery around anger management with them, I wanted to be able to show some real-time data to them so that they could see that the hard work that they were putting in was having benefits, instead of sending them home, hoping that something gets done, having the parents come back the next week and spending 20 minutes with the parents trying to recall what happened in the past week, which was basically they can't remember what happened in the past week, but they're sure something didn't go right, but they don't really remember what it was. So this has been important to me, and I'll give you a couple just quick examples, but like when I do exposures with kids, it allows them, as the real-time data is being collected from the Muse, but also from the heart rate watch, it allows them to see when they're becoming over-anxious, when they're struggling a bit with their fears, right? But at the same time, as I do the relaxation exercises with them, it allows them to come down into the relaxation zone, and I think that feedback to them is really important. It keeps them motivated, it keeps them engaged. Similarly, I bring the parents in at the end of the session. I'm able to show them the data, and I think that's really important for parents to keep their motivation engagement in the treatment plan as well, because they're, like all of us, we want to see something that works, and just telling a parent that their kid is getting better is not really cutting it. So they're able to join in, I think, be more engaged, and then serve better as coaches at home, particularly around kids with anxiety, which the parents really need to do. And I've also used this with kids with anger management issues. So I have a 9-year-old I'm working with who, let's just say, is not a real big fan of his younger brother. And what often happens at home, younger brother annoys him. Younger brother can do something as simple as rolling his eyes. And then my client will sort of fly off the handle. And then it really sets the family into a tailspin in the sense that there's lots of tension, lots of blaming going on. And so I've been able to work with him around the anger management to show him, as I go through some of the guided imagery, about thinking about his brother, or the eye rolls, or the perceived slights that occur. And you can see his physiology is really just off the chart, right? He just becomes so reactive so quick. But then I'm able to do the relaxation exercises with him and actually get him to be able to calm down a little bit and see that he's able to get into the relaxation zone. And this was using this technology, again, to augment the strategies, the interventions that I'm doing in the practice has been really important. He's a very analytically thinking kid. And for weeks, I think I was sort of sending him home and saying, well, when you see your brother do the eye rolls, just start doing these deep breaths. But in fact, what happens at home is as soon as the eye rolls happen, the emotion is so quick that he just couldn't do it. And so I felt like for weeks we were just sort of spinning our wheels. But he's now been able to generalize, which I think is the important thing, what I'm doing in the treatment setting with him to the home setting. And that's made the family life a lot more bearable, I think a lot more happy. And the parents are able to see it both through the session and then apply some of it at home. So I think both, as Chris and Adam mentioned, I was a client first, which was most important. I wanted to take this for a test run, and I was really impressed because I saw the outcomes coming from it. And it wasn't until that I said, look, I'd love to join the advisory board. I think, kids are who I work with, and this is a great population. And so I've been thrilled to just be working with such an energetic group of folks who have the right mission in mind.
Thanks. And that's the type of feedback that keeps us energized, gets me out of bed in the morning when I know that providers and patients are feeling better, faster, and feel a sense of hope from a military environment, big macho environment that doesn't want to seek help all the time for mental health. If I can visualize this and show them that progress, I think we help fight that negative stigma too. So this, just real quick, is I wanted to demonstrate and show you how something like this actually looks and what does it look like to a patient. I try to make it as seamless as possible for them and as inviting as possible, not like a lot of data that frankly I don't understand. That's for the science guys on the team. And this is just a demo account, fake psychologist Dr. Don, but this is my account, so I try to do mindfulness every day and help me throughout this process. And so you see we could track and measure questionnaires, validated assessment scales. These things can be assigned to patients remotely. So if Dr. Don wanted to assign me something, he would just go here, assign an exercise, say he wants to assign me a journal entry, prompt, APA TMS talk. Let's see, due date, we'll have that due maybe next week. Time, same time next week. You notice it's military time. That was a habit, sorry. Additional notes, journal on 3 things that went well during the discussion. Save changes. And now that gets immediately emailed to me as a patient. I see that this journaling assignment was assigned to me. I get a notification of the due date, the prompt. I could log right into this platform myself on my cell phone or at home on my iPad. And I could complete that journaling assignment. And like I said before, I'll get then those positive impact points for actually doing that. Life gets busy, a week goes by, I forget about that assignment, I don't have time to do it. Our system automates a reminder to them, a nudge. Hey, remember you have that journaling exercise, get in there, earn some exciting rewards and take ownership of your mental health. And then as a provider, you could go in, you could see any previous journals, you could see their exercises and if they've actually finished them, and you have a dashboard for all of your, part of the why this is blurred out is that is one of our HIPAA compliant measures, so that someone just walking by your screen can't see names, but you could unhide that and you can go and you could see all your patients. If you wanted to do a mindfulness session, you would click new session. We don't have the wearables hooked up right now, but after this, if anyone's interested, we're more than happy to show it to you live. So we'll just do skip wearables. So you could still run a session, you could still do guided meditation. So here we have content built right into the platform where they could do a guided meditation exercise.
You are about to embark.
That was loud. If you have one of the heart rate monitors or the EEGs set up in real time, you would see this graph populate with the relaxation levels, with coherence with your heart rate data, so you could correlate how they're doing on a physiological, objective level in real time. And this just speaks to more of where we are as a company. So we've been around for 2 years. This month actually marks 2-year mark, and done a lot of research at the University of Pennsylvania. Just concluded our beta phase, and we're really excited. 34 clinics now around the country are using this with patients, both inpatient and outpatient environments. There's a clinic in London too, so growth is exciting, and we're looking for clinical partners. In fact, we're not only looking for clinical partners, we're looking for research partners. So again, this has been positioned not as a direct-to-consumer model. We want to be a resource and asset to you, the clinician, making it easy enough for your patients to use as a consumer. But there's something about, I think, the importance of using this under clinical supervision, at least to start. And so with that in mind, all of our science, all of our, the methodology, the design is based on research, and that's because of our research partners like the University of Pennsylvania. So we have a small grants program. And so if any of you are researchers or know researchers that want to use NeuroFlow in their program, whether it's the behavioral economics component, the wearables, the data, or the homework tracking component, we'd love to talk with them and see if we can work together and partner in that capacity.